stopped. So yes, during your assessment, yeah, part of it is, yeah, we're assessing how many locations that person can handle, and that's part of their visual scanning abilities, okay? Would tell us, again, how many items they can handle when we're presenting an AAC system to them, okay? But it is trial and error, okay? But our goal is, again, to try and max out the number of items that they can see at once, okay? Because we want to provide the most words, okay, to that person that we can, okay, per screen, okay, because that would give them the most opportunities for communication and reduce, say, if they were using multiple screens for communication, it reduce the amount of navigating or searching, okay, through different pages to find vocabulary, okay. So if a student is only using 9 or 15 cells per screen, and their vocabulary starts to grow, then what? Then we're making more screens, more pages, okay? Then that takes what? More what? To use their system, right? It slows them down, more time, okay? So, so that's the goal, okay? We want to provide the most words that we can per screen, what they're capable of doing, and it's trial and error, okay? So, yeah, we're considering physical considerations, vision, and cognitive abilities in how many locations we provide on a system. Okay, so if you're doing more of a formal assessment, okay, it depends on the setting that you're working in. They may ask you to do a formal assessment, okay, as the SLP, okay. When I get calls more recently through my practice, you know, it's been commented that the SLPs working at, you know, the different schools, that they're doing their own AAC assessments, which is good, okay. It's a signal to me that kids are getting AAC, okay. They're not just waiting for a specialist or somebody like me to come in and do an evaluation. So more kids are getting access to AAC, which is a good thing. So when you're doing an AAC assessment, though, you should be following what's called a feature matching approach, okay? So you should, to kind of help you, okay, so we kind of talked about generally, okay, who should use unaided, who should use manual, who should use high-tech, and some of the general considerations that we need to start thinking about. How many locations on a high-tech system? Do they have negative behaviors? All those things, you know, generally. Okay, now we want to say, okay, we feel Johnny can handle high-tech, okay? All right, now what? Now what app? So we went through all the apps, okay, last class, okay. So we need to know, though, look at the different features of the potential apps that are out there, the good ones. You don't have to know every single one, okay, but the ones I've taught you and discussed in class, those are the good ones, okay. So looking at the different features of those apps, and then now looking at your client, okay. So looking at the features, okay, of the AAC available options, okay, and then matching it to your client. That's what we call feature matching approach, okay. So looking at your client's language skills, okay, their symbolic skills, their how many locations they can handle on a screen at a time, okay. Are they just at the choice-making noun level of communication? Are they have the potential to start learning some core words, okay? Can they start learning some basic syntax and combining some words to put together some basic utterances, okay? So the biggest thing is for you to know the language and cognitive capacities of the person you're working with. Okay, so if you know their potential as far as language and cognition, what they're going to be able to communicate, then you'll be able to then look at the different AAC options, okay, the different apps and or SGD, to then make a determination on what kind of vocabulary program that would best meet their needs. Okay, so so this is kind of the rationale for your iPad project. Okay, so I tried, to kind of simulate the kind of demand that you would have out in the field by kind of giving you a pseudo person, okay, with the background. Okay, now choose which page set in TouchChat then would match, using feature matching assessment approaches, would match their language skills and their communication needs. Okay, so you're basically doing like a little mini assessment, okay, in your iPad project. So based upon then your ideas of possibilities for your client, then you're going to try them. Okay, so you can try them, okay, during trials, okay, and then you're going to document the client's performance, okay, just like any other kind of assessment. Okay, so you're going to assess their skills, abilities to communicate with intent, their accuracy, okay, using say, several different apps that you might think is appropriate. Okay, it might be though that given your client's skills, that they're really at the very basic choice-making level of communication, and it might be that the Go Talk Now app you feel is more appropriate. So it's not to say that you have to present TouchChat or Proloquo to Go, and it's not appropriate for the child that you're just starting to work with, who's only just using nouns and photos for communication. So I'm not saying you have to present other apps just because, okay? But as long as you can justify why you're only considering Go Now, versus Proloquo and TouchChat in your report, in your assessment, then that's fine. But bottom line is that, you should be knowledgeable about the different apps that are out there, not just know TouchChat or not just know Proloquo to Go, if you're going to be fair to your client. Okay, so you should be knowledgeable about the different AAC apps that are out there, if you are responsible, for doing assessments, for your own clients, wherever you are working. So, again, it's not, hard to kind of learn about the different apps. You know them already now leaving this class about the major ones to consider, okay? You can always do some more Google searches about some other apps. You can look at them in the App Store, okay, and make some clinical decisions if you think they could be appropriate or not. A lot of the apps have demos now. You don't have to buy them, okay? You can try them out with your client. Go Talk Now, like I mentioned, is free. Okay, you can try it with your client before you decide to buy it. So. All right, so these are the different cognitive and specific communication skills we're looking at, and we kind of talked about them already to some extent. But alertness and attention span, okay, so why would that be important for us to know when we're considering AAC for someone?
They can handle the time, once they're alert and engaged, that's a good sign right there. Their attention, if it's a high-tech device, it's going to take more than 10 seconds possibly to find that symbol. It could take 35 seconds.
Right.
And they need to have an attention span to be able to do that task.
Right.
And then they need to be alert. They need to be
aware of their surroundings, be able to, aware of other people. Exactly.
In the task at hand, what's happening.
Aware of the language that's presented to them receptively. Okay, do I have receptive language on there somewhere? Communicate with intent.
The next slide.
On the next slide, okay. Yeah, question?
Just to add on to what he was saying, it's the first foundation that a child needs to have in order to be able to do any kind of communication.
Right, it's the cognitive piece.
Yeah.
Exactly, right. it's alertness, attention, memory, and information processing. Those are all the primary cognitive tasks. Yeah. So, and specifically in that, you were saying attention though to the AAC device, okay, because it does take time to find your vocabulary, okay, depending on what kind of app you're using, okay. So, so does the child have attention to kind of stay with it, okay, to be able to find their words, okay? So those things need to be considered, you know, or do we have to present more of static display kind of approach, you know, like the Go Talk Now, where they just see the words and the options at one time, you know, and that has to be more controlled by an adult, you know, because maybe the attention is more fleeting, you know, to the system. When we're using aided forms, like I said, you're presenting information visually. Okay, so do they have the visual attention, okay, and be able to visually process, okay, that information that we're presenting on the iPad or AAC device. Object or pictorial permanence. So object permanence. Why is that important as it relates to AAC? Yeah.
But it's like a lot of the times you may click on something and then it brings you to an entire new screen. You don't want them to like maybe not realize that the last screen you could go back, or you know, one screen clicks into another and brings you to a whole new set of, you know, a new theme or options, right? And you don't want them to feel like, you know, oh, okay, this is what it is now because it's here, as opposed to like, oh, I clicked it, now this is why it's here.
Exactly, right. So that's, I mentioned earlier, for a child who's going to use a dynamic display or navigate through screens and pages, okay, they have to understand that, you know, they're not seeing the word that they want right away. It's hidden and embedded. You know, can they find, you know, their target vocabulary within multiple screens, and you know, remember. They have the memory skills to remember where they are, you know, and I call it the navigational path, so they can remember the different selections they need to make to actually end up getting to cookie or chips or whatever they're looking for. But also just the general cognitive skill of object permanence. It's, yes, it's a developmental cognitive skill, right. But how does that relate to communication? I guess is what I'm trying to say.
They want something that's not in the room.
Right.
Yeah.
Sorry.
Right. So they don't, yeah, things, they're still aware of things that they would want or need that they don't see. Okay. So, and again, we take it for granted because it's a very early developing skill, you know, that toddlers learn, okay, and young children learn. But depending on the person you're working with and the extent, okay, of their disability, okay, that may or may not be established. Okay, and I work with a lot of kids. I just did an evaluation a couple weeks ago where it was questionable. This child had object permanence, okay, and he was 9, but he had a very significant history of neurological, medical history where he had, as a young child, chronic seizures, chronic epilepsy. So they actually had to do brain surgery, okay, to stop the seizures, and part of that brain surgery was removing some part of his brain. Okay, so so obviously he has now intellectual disabilities from that. So with this particular child, I couldn't really truly determine in the one-time evaluation that I was doing if he really had object permanence, because it seemed from my interviews with staff and then with working with him that he had to see things in the environment to ask for it. Okay. That he wasn't making requests or trying to communicate things that weren't in the here and now or in the context or that he could visually see. Okay. And he could talk, he could verbalize, even though articulation wasn't great and his volume was low, he still could verbalize words. And it was primarily things that he could see within his environment. So that gives me another clue, object permanence. So if he could talk, and he had object permanence, then he may be saying words and talking about things that he didn't see. Do you see where I'm going with that? So, and the fact that staff often had to verbally give him a list of choices. So they would say, Johnny, do you want pudding or Jell-O or crackers for lunch? So they're listing the possible items that so if it's not something he could see, okay, they would have to tell him the choices and then he would verbalize. So again, that points to me that he had some issues with object permanence and being able to understand and remember. It's the cognitive, because it's the cognitive piece, remember things that he couldn't see.
When they asked him, or when they listed the items, did he also have them out in front of him?
Not always. So I guess, yeah, so he could, I guess, understand when you say the word Jell-O, he would know what that was for food. So maybe, for those kinds, that was the examples they gave me, was more for food choices. So that may have been some kind of memory, yeah. But they said for other things, no, it was in the environment. So that's something I had to document on my report, that it could not be determined, okay, if he's going to be able to use this AAC system to really talk about things that aren't in context or in the here and now, so just to be, so everyone's realistic about, the use of the AAC system. So, we talked about symbolic representation skills, we talked about communicative intent,
symbolic play, that's so important.
What's that?
Symbolic representation, symbolic play too. In
Yeah.
terms of growth and cognition.
Right. Young kids, yeah, we work on symbolic play skills to work on their general cognitive skills to be ready for, using symbols, yeah, for communication. So, all right, so just a last comment here about ability to make choices. All right, so for a child to be able to make a choice over one thing or another, okay, they have to have established preferences. So they have to want to choose crackers over pudding. Do you see what I'm saying? Okay, so that's kind of the foundation of starting to use expressive communication, okay, and communicating your wants and needs. You have to have a want, okay, where some children, again, who are more limited, may have limited preferences, okay, that you're working with, if you're working with children who are more involved. So it may take more work, okay, to find out what makes that child click. Okay, what some of those preferences are. And it might be non-traditional things if their play skills are not developed, okay, and their interest in toys are not developed, okay. It might be they like everything blue, okay. It might be that they have, okay, some odd kinds of preferences if they're, diagnosed with ASD and they have very limited play skills. But you have to find out, again, what makes that kid click and what their preferences are to be able to provide those choices, okay? And especially food items are often used very often because they're kind of one of the first things that a kid has preferences over, okay? But again, try and go beyond food is what I'm saying. There's always things that kids like. It might be like a koosh ball, it might be like, sensory kinds of things, okay? So try and find out what that kid likes, and then try and work still on choice making beyond food, if you're working with a child who is more limited, in their preferences. Let me see what else I had here. All right, so I don't want to keep you much longer, but what I'll do is the next time I see you on the 28th, right? No, 21st. I can't keep track.
28.
28th is when I'm seeing you next. Okay. So when I see you again on the 28th, I'll just finish up with these slides left. Okay, that we need to talk about. All right? All right. Safe travels home. All right. I'll see you on the 28th.
So, took him away. We went to a Korean restaurant Saturday night. My son took the chopstick, and it was a lightsaber.
There's your symbolic way.
Oh my god! And so I promised him after the comps I'll get him an actual lightsaber. But oh yeah, he was, Obi-Wan Skywalker. He wanted to do lightsaber duels.
That's funny.
Yeah, it's cool.
Yeah. So what is the date for the comps?
30th.
30th. Oh, God.
Okay.
Oh,
Sorry.
2.5 weeks.